What if I told you that some of the most common medical checkups recommended after age 70 could actually be doing you more harm than good? I know that sounds shocking. For decades, we've been told that more checkups always mean better health, that constant screening is the key to catching diseases early and living longer. But according to leading voices in medicine, including Dr. Peter Attia, one of the most respected physicians in the United States in the field of longevity and preventive health, that simply isn't always true. Dr. Attia often reminds us that the goal of modern medicine should not be to order endless tests, but to carefully weigh risks against benefits. And especially after the age of 70, some tests can create more problems than they solve. False positives, unnecessary treatments, exposure to radiation, even invasive procedures that can actually shorten life instead of extending it. And he's not alone. Several large studies published in respected journals like The Lancet and JAMA Internal Medicine have confirmed that over-testing in seniors leads to overdiagnosis, over-treatment, and complications that often outweigh the supposed benefit. Yet millions of older adults are still encouraged to take these exams every year. That's why in this video, we're going to break down 5 common medical checkups you should think twice about after 70. For each one, we'll explain what the test is, why it may carry risks at your age, what the research says, and what alternative approach many experts, including Dr. Attia and other leading physicians, recommend instead. This isn't about ignoring your health. On the contrary, it's about protecting it by making smarter, evidence-based choices that reduce harm and maximize your quality of life. Because after 70, the way you approach medicine should change. It's not just about living longer, it's about living better. So stay with us, because you're about to discover which 5 health checkups may not be as helpful as you've been told. And trust me, the last one on our list is the most surprising of all, because almost everyone believes it's harmless, until you hear the full story. Before we dive into the specific checkups, let's take a moment to understand why this issue is so important, and why experts like Dr. Peter Attia have been warning about it for years. Once you cross the age of 70, your body responds differently to both medical interventions and treatments. What was considered a safe and helpful screening at age 50 or 60 can become less reliable, and in some cases risky, after 70. That's because tests are more likely to show false positives at this age, leading doctors to order further exams, prescribe new medications, or even recommend procedures that carry greater danger for older adults. Dr. Attia often points out that the practice of medicine should not be about ordering every possible test, but about asking a critical question. Will this test actually improve the quality or length of life for this specific patient? And many times the honest answer, especially in people over 70, is no. Take this statistic. According to a 2022 report in JAMA Internal Medicine, more than 40% of seniors receive at least one unnecessary medical test every year. These unnecessary tests often lead to stress, anxiety, and follow-up procedures that carry their own risks. And here's the kicker. Research shows that avoiding over-testing does not shorten life expectancy. In fact, it often preserves independence and prevents complications. That's why this conversation matters so much, because at this stage of life, health is about balance, protecting yourself from what is truly dangerous while avoiding unnecessary risks that medicine itself can create. And that's exactly what we're about to do. In the next few minutes, we'll go through 5 of the most common checkups that doctors and researchers say may be harmful after 70. For each one, we'll explain why it can backfire, what the evidence says, and what smarter alternatives you can discuss with your physician. And the first one is a test that almost every senior has been told to get regularly. Yet the latest research shows it may do more harm than good. Let's start with number 5. Number 5 on our list is the routine colonoscopy after the age of 70. For decades, colonoscopies have been considered the gold standard for detecting colorectal cancer. And for adults between 50 and 69, the benefits are clear. Studies show that regular screening in that age group reduces the risk of dying from colorectal cancer by up to 68%. That's why so many doctors encourage people to continue them into their 70s. But here's the problem. Once you pass 70, the balance between risks and benefits begins to change dramatically. Colonoscopies are invasive. They require anesthesia, carry a risk of bleeding, and in rare cases, even perforation of the colon. And as your body ages, it becomes less resilient to these complications. What might be a minor setback at 50 can become life-threatening at 75. Dr. Peter Attia often stresses the importance of asking whether a screening test will actually change the outcome of your life. For many seniors, colonoscopies after 70 no longer provide that benefit. Why? Because colorectal cancer develops slowly. If you've had consistent screenings before 70, the odds of discovering a new cancer that would actually affect your lifespan are extremely small. On the other hand, the risks of complications from the procedure itself increase with age. In fact, a large study from the Annals of Internal Medicine reported that after 70, the rate of serious complications from colonoscopy nearly doubles, while the survival benefit from additional screenings shrinks close to zero for most patients. That's a powerful reminder that more testing is not always better care. So what's the smarter approach? Many experts recommend stopping routine colonoscopies after 70, especially if you've had negative results in the past. Instead, discuss with your doctor whether non-invasive alternatives, such as stool-based tests like FIT or Cologuard, may be safer and more appropriate. These tests carry little to no risk and can still flag potential problems without exposing you to invasive procedures. Now, let's be clear, this doesn't mean you should ignore symptoms. If you experience bleeding, unexplained weight loss, or changes in bowel habits, you should absolutely consult your doctor immediately. But for routine, scheduled colonoscopies after 70, the risks often outweigh. Number 4 on our list is one that has grown more and more popular in recent years: the annual full-body scan, often done with CT or MRI. Even when you have no symptoms at all. The idea sounds reassuring. Get a complete picture of your body, catch any hidden disease before it develops, and rest easy knowing you're covered. But according to leading experts, including Dr. Peter Attia, this type of screening is one of the most misleading and potentially harmful practices, especially after 70. Here's why. Full-body scans expose you to several risks. First, CT scans involve radiation, and repeated exposure increases long-term risks without clear benefit at this age. Second, these scans are notorious for producing false positives. In other words, they detect spots, shadows, or abnormalities that often turn out to be harmless. But once something suspicious shows up, doctors usually order more tests, biopsies, or even surgeries, many of which are unnecessary and risky for older adults. A 2021 study in the New England Journal of Medicine found that in asymptomatic adults over 70, more than 60% of abnormalities found on full-body scans were false alarms. And nearly 30% of those patients went through additional procedures that caused complications, hospitalizations, or long recoveries. That means instead of reassurance, the scans often lead to anxiety, medical costs, and avoidable harm. Dr. Attia has emphasized in his own work that preventive health isn't about ordering every possible test, but about focusing on the right tests at the right time for the right person. For most people after 70, routine whole-body scans without clear symptoms simply don't meet that standard. So what's the smarter alternative? Instead of broad, unfocused imaging, talk with your doctor about targeted screening based on your specific health history and symptoms. If you have known risk factors, a family history, or concerning signs, then imaging might make sense. But using it as an annual blanket checkup, the science just doesn't support it, and the risks outweigh the benefits. And remember this, peace of mind doesn't come from more scans. It comes from smarter, evidence-based decisions that protect your quality of life rather than exposing you to unnecessary worry. Now, while scans may sound high, number 3 on our list is the PSA test for prostate cancer, performed routinely in men over 70. On the surface, it seems like a no-brainer, a simple blood test that looks for elevated prostate-specific antigen, or PSA, which can signal the presence of prostate cancer. Doctors have promoted this test for decades as an easy way to catch cancer early. But here's the reality. After 70, the risks of this test often outweigh the benefits. Why? Because PSA levels are not specific. They can rise for many reasons unrelated to cancer, things like inflammation, infection, or even normal changes with age. For men over 70, false positives are extremely common. And what happens after a false positive? More tests, often a prostate biopsy. Those biopsies carry risks of infection, bleeding, and hospitalization. And even when cancer is found, many of those cancers are slow-growing and would never have threatened the man's life in the first place. According to the U.S. Preventive Services Task Force, routine PSA screening is not recommended for men over 70. Their data shows that for every life potentially saved, dozens of men suffer harm from unnecessary treatment, surgeries, radiation, hormone therapy, all of which can cause lasting side effects like incontinence, sexual dysfunction, and chronic pain. Dr. Peter Attia often points out that in longevity medicine, the key is understanding the difference between life-extending interventions and life-disrupting ones. A routine PSA test after 70 frequently falls into the second category, creating fear, leading to interventions, and reducing quality of life without adding meaningful years. So what's the smarter path? For most men over 70, doctors recommend stopping routine PSA screening unless there are very specific risk factors, such as a strong family history or aggressive symptoms. In those cases, decisions should be made on an individual basis, weighing risks and benefits carefully. For everyone else, the better strategy is watchful waiting and lifestyle management, focusing on nutrition, exercise, and overall health markers that have a far greater impact on longevity than chasing down every possible cancer cell that might never cause harm. This is why routine PSA testing makes our list at number 3. It looks harmless, even helpful. At number 2, we have the routine cardiac stress test, often ordered for seniors during annual checkups, even when there are no symptoms of heart disease. On the surface, a stress test sounds like a good idea. You walk on a treadmill, your heart is monitored, and the doctor checks for potential blockages. But here's the truth. For adults over 70 who don't have chest pain, shortness of breath, or other warning signs, this test may be not only unnecessary, but harmful. Why? Because stress tests have a high rate of false positives in older adults. Age-related changes in the heart, medications, or even reduced fitness levels can cause the test to appear abnormal, even when there is no serious disease. Once that happens, doctors often order additional exams, CT angiograms, catheterizations, or even stents, procedures that carry risks of bleeding, kidney damage, and other complications. Dr. Peter Attia has spoken extensively about the importance of tailoring cardiac screening to the patient, rather than applying a one-size-fits-all approach. He emphasizes that preventive cardiology should focus on risk factors you actually have, not just on blanket testing. For many people over 70, a routine stress test without symptoms is more likely to open the door to unnecessary interventions than to save a life. The American College of Cardiology and the U.S. Preventive Services Task Force both agree. If you don't have cardiac symptoms, routine stress testing is not recommended after 70. Studies show that these tests do not improve longevity in asymptomatic seniors, but they do increase anxiety, cost, and exposure to risky follow-up procedures. So what's the smarter approach? If you're over 70, focus on managing blood pressure, cholesterol, exercise, and lifestyle, the real drivers of heart health. And if symptoms do appear, That's when a stress test or targeted imaging becomes appropriate. In other words, test when there's a reason, not just because of age. This shift in thinking is crucial. Too many seniors end up with stents or bypass surgeries they didn't actually need, all because of a false alarm from a routine stress test. Protecting your independence means avoiding those unnecessary risks. And that brings us to number 1 on our list. It's the most surprising of all. Finally, at number 1, we have a test that almost every senior has been told is safe, quick, and even essential: the annual chest X-ray for lung cancer screening. It sounds harmless. Just a simple X-ray, a few seconds, and you leave the clinic with peace of mind. But here's the shocking reality. Major medical organizations now warn that routine chest X-rays for lung cancer screening, especially in people over 70 without symptoms, do more harm than good. Why? Because chest X-rays are not very accurate at detecting early lung cancer. They often miss small tumors, while at the same time flagging harmless shadows, spots, or scars that lead doctors to believe something is wrong. The result? A wave of false positives. And once that happens, the next steps are often CT scans, invasive biopsies, or even surgery. For seniors, these follow-ups carry significant risks: radiation exposure, lung punctures, infections, and long recovery periods. A landmark study published in the New England Journal of Medicine followed thousands of older adults who received annual chest X-rays for screening. The results were crystal clear. Routine X-rays did not reduce lung cancer deaths, but they did lead to a high number of unnecessary procedures and complications. Dr. Peter Attia and other longevity specialists emphasize a critical point here. Just because a test is easy to do doesn't mean it's safe or effective. Preventive medicine is about asking, will this test meaningfully extend life or improve quality of life? In the case of annual chest X-rays, the answer for seniors is a resounding no. So what's the alternative? If you have a history of heavy smoking or clear symptoms like chronic cough, weight loss, or coughing up blood, then the recommended approach is a low-dose CT scan, which is far more accurate at detecting meaningful disease. But for seniors with no risk factors or symptoms, routine annual chest X-rays should be avoided. The risks outweigh the benefits, and the evidence is overwhelming. Think of it this way: medicine should protect you, not put you through unnecessary fear, radiation, and invasive tests that don't actually improve survival. By skipping this outdated practice, you protect both your body and your peace of mind. And that's why routine annual chest X-rays for lung cancer take the no. Let's quickly recap the 5 medical checkups you should think twice about after 70. Number 5, routine colonoscopies. Helpful earlier in life, but after 70, the risks of complications outweigh the benefits. Number 4, annual full-body scans. They sound high-tech, but studies show they cause more false alarms and unnecessary procedures than real protection. Number 3, the annual PSA test for prostate cancer. In older men, it often leads to overdiagnosis and invasive treatments that don't extend life. Number 2, routine cardiac stress tests without symptoms. They're more likely to trigger unnecessary stents and surgeries than to actually save lives. And number 1, the annual chest X-ray for lung cancer screening. Harmless in appearance, but proven ineffective and potentially harmful for seniors without risk factors. The key message? After 70, more testing does not automatically mean better health. What matters is choosing the right tests at the right time based on your personal risk and medical history. That's how you protect both your health and your independence. So here's the takeaway. After 70, protecting your health isn't about doing every test possible. It's about making smarter, evidence-based choices. As Dr. Peter Attia often says, longevity is not just about living longer, it's about living better. By understanding which screenings may cause more harm than good, you're already one step ahead in taking control of your health and independence. And remember, none of this means ignoring your body. It means working with your doctor to focus on the tests and habits that truly keep you stronger, safer, and healthier in the years ahead. If you found this video helpful, please consider subscribing to our channel. We share new senior health tips every single week, designed to give you practical, science-backed guidance for living your best life after 60, 70, and beyond. And don't forget to share this video with a friend or loved one who could benefit from this information, because sometimes the right knowledge is the best medicine of all. Thanks for watching, take care of yourself, and I'll see you in the next video.